I'm going to stop sharing that screen, and you should be able to see our speakers. So I'm going to just hand over now to our chair, Jen Ang. Jen is the founding co-director of Just Right Scotland, which is a legal charity that helps people use the law to defend and extend their rights. I'm sure you're familiar with their work through the Scottish Women's Rights Centre, where they help run helplines, surgeries, direct advice and representation for women survivors of gender-based violence across Scotland, and we're so delighted that Jen is here to chair the discussion today. So over to you. Thanks very much.
Brilliant. Thank you very much, Alice. I'm just going to check, as I always do, that everyone can hear me okay and we're sitting comfortably. No, it's perfect. Always very reassuring. It's a different world, isn't it, in terms of how we convene events, but equally this event is a wonderful example of some of the opportunities when we use remote technology like this to come together. In another day, there would have been a lot of travel and it would have been harder for people to join. So it's excellent to see all of you here today, and an honor to be able to attend as well. So it falls to me to welcome you to this event convened by the UK Joint Committee on Women, which is a coalition, as you know, of the 4 women's organisations who jointly represent the UK at the European Women's Lobby, and aim to support women and women's organisations to access information and inform the EWL's actions. Today's webinar is about taking a closer look at the impact of COVID-19 on women in the 4 nations, and we'll be hearing from representatives for each of the organisations in the devolved authorities. I'm joined here today by Emma, Yona and Catherine from Scotland, Northern Ireland and Wales, as well as by Katrina for the European Women's Lobby, giving us a perspective, a kind of a European-based cross-national perspective on the work that you've seen. We know, and I'm not going to over-egg this because I think our panelists will spend some time exploring these issues in the context of each nation, but we know that women have been disproportionately impacted by COVID-19 and also disadvantaged by the law and policy response that we've seen to COVID-19. It's not surprising because of the work we do, because these are reflections of systemic issues, but it also falls to us heavily to ensure that organisations work to raise awareness and shed light on these inequalities, and turning to our more positive opportunities to push governments for a gendered response to the challenges we're facing, because there is still time to influence our response to the pandemic and to how we step away from the pandemic. So the plan for today is that we will be hearing from representatives in each of the nations about their government response and about what the organisations have been focusing on, really kind of drawing that opportunity to jointly reflect and identify the common themes. And also my understanding is that each of the organisations in the devolved nations have slightly different roles and compositions. So there may be something to observe as well about how we use the resources we have to tackle the issues in our nations. But first, we're honoured to be joined by Katrina Graham. She's a Policy and Campaigns Officer from the European Women's Lobby, and has been given the task, and thank you so much, Katrina, for joining us, of starting us off with a brief discussion about some of the broad themes that you have seen in your work at the European Women's Lobby around COVID-19 and its impact on inequality for women. So with that, I will mute myself and hand over to Katrina, and respectfully thank you as you go. But thank you very much, Katrina.
Great, thank you so much, Jennifer, for that lovely warm introduction. So I know that Joanna was supposed to be joining today. Joanna is the Secretary General of the European Women's Lobby. So just on her behalf, I want to send apologies, but also a very warm welcome to everyone who is attending the event today. So yeah, the European Women's Lobby actually was founded 30 years ago this year. So we are getting to be quite a mature organisation at this stage. We have grown from the beginning days of a group of women who thought it was really crucial to bring together the European women's movement and the voices of women towards the European institutions, to today being an organisation of more than 2,000 women's rights groups. We are really working together across the European 27 member states and countries that have a relationship with the European Union, such as the UK, and it's great that we still have all of our wonderful members in the UK as part of our movement. Really to bring the voice of women towards the European institutions to make sure that we are staying at the forefront of challenging and supporting the European institutions to really progress towards women's equality. But also then bringing together the women's movement across Europe. So making sure that we're also supporting engagement for transnational collaboration and cooperation. We do that with a few key priority topics, such as working to end violence against women and girls. On that, I would maybe reference that tomorrow is, of course, the day for the elimination of violence against women and girls. So a really important moment in the calendar year, and I'm sure all of the members will be really active over the next 16, 17 days for the 16 days of action on combating violence against women and girls. So best wishes to all of those who are engaging in those topics. We also work on sexual and reproductive health and rights, combating sexual exploitation, supporting women in digital spaces in all of the different ways that entails, working on women in leadership with a particular focus on the role that women have to play in formal politics, but also in political spaces, making sure that we work on supporting grassroots movements as well as women in government and in political decision-making spaces, wherever our voices should be heard, and working to create a feminist economic system that works for all women and girls. We do this work through a strong board representing all of our different member countries, European level member organizations working on special topics. We have working groups that bring together experts from all these different countries on these thematic topics, and also task forces, including groups looking at, say, what is happening in particular regions in Europe, such as the Mediterranean or the Central Eastern European, Balkan and Baltic states. So really trying to make sure we can focus on where do we need to bring our particular focus at a given time, and how can we best support our members in the work that they are doing. Of course, COVID-19 has brought a number of significant challenges to that work, both in terms of how we can coordinate for a comprehensive transnational response to this crisis, and doing our best to support members at national level as well, as we're trying to grapple with a whole new context, both for our own work and in supporting member states in making those difficult decisions about how to prioritize, making sure that women aren't overly impacted by the different challenges we've seen coming up through COVID-19. Some of the particular areas of focus that we have noted according to this would be women on the front line. I think we've seen that there is this amazing new recognition of what is truly work of important value and what is essential work in our societies. That's been amazing to see, this public recognition of this piece. But we have seen at the same time that those who are on the front lines providing essential care and work are also those who are facing some of the most challenging professional situations. So this has really become a key area of focus, I think, for many of our members and for ourselves. And making sure that women are not silenced, that we're still having our voices heard in all the political decision-making processes of emergency responses, including the European plans for redesign and renewal of our systems in consultation with women's civil society organizations, making sure that democratic principles of the EU are still recognized and respected. We've seen the rollback of a few freedoms as part of this whole piece in responding to COVID. That has been necessary, but for us, it's very important to make sure that we can bring back in all of the different devolved powers that are crucial for individuals' freedom and women's freedom, and tracking progress with our members really closely to see how institutions and member states are working, including data collection, making sure we're bringing forward those voices and messages to the decision makers, making sure that all of the immediate progress being taken is in line with longer term measures, such as, for example, the ratification and implementation of the Istanbul Convention, and making sure that any response to the economic challenges we're facing today do not end up having the same kind of impact as we saw the austerity measures of nearly 10 plus years ago having. So I think those are some of the crucial issues that we've seen coming through from our members across Europe. And I'm really interested to hear whether that mirrors the impacts that you've seen within your different spaces and organizations. Thank you so much.
Thank you very much, Katrina, for both introducing the work of the European Women's Lobby for us, and then actually highlighting what was a dizzying list of impacts to monitor and things to bear in mind as we move through COVID. And I think you're right. It'd be interesting to see how that's reflected in the comments of our panelists to follow. And also, it does make me reflect that you know, that the ordinary panel of work that we had in mind for 2020 was heavy and vast, and COVID is an overlay, but it doesn't also change the need to continue to attend to the longer term systemic issues. If anything, it's important to hold sight of that whilst we're also responding on an urgent basis to the new challenges. So thank you. So with Katrina's introduction, framing nicely what we need to discuss next, we're now going to move to our panel discussion. Each of our panelists is going to give a brief presentation around how the government in their devolved area has or has not supported women in the pandemic, and what has been your organisational focus in responding to these issues. We will start with Emma Ritch from Engender, who you all know, but I will introduce Emma and her impressive background. Emma is Executive Director of Engender, which works on women's social, economic and political equality in Scotland. She is also a member of the Scottish Women's Rights Centre's Advisory Committee, the Scottish Women's Budget Group, and is acting chair of the Scottish Human Rights Commission's Management Committee. She's a member of the board of Rape Crisis Centre in Glasgow, and the Scotland Committee of the Equality and Human Rights Commission, and is also on the board of the Women 50-50 campaign. So I'll hand over to you, Emma, to kick off. And we had originally allocated about 5 minutes, but actually we have a little bit more time. So, so please just present us with what you have to say, and I will slow you if we seem to be running short of time. Thank you, Emma.
Thanks very much, Jen, for that really kind introduction. So I think when the crisis first hit, Engender had 3 strategic priorities in terms of how we were going to respond and what we wanted to see Scottish Government do. So the very first priority we had was ensuring that women and gender was integrated into the crisis response itself. The second thing we wanted was to try and stop, where possible, Scottish Government from moving their focus from the women's equality and rights commitments that they had already made. We knew from sisters around the world that in a crisis, often there's a huge deprioritisation of women's education outcomes, for example, and even health outcomes, and then a kind of reprioritisation of resources onto pandemic response. And we wanted to make sure that as far as possible that didn't happen when government reorganised itself to deal with the crisis. The third thing we wanted to do was ensure that when the recovery was planned for, that it integrated again issues around women's equality and rights, and that somehow we could try and close some of the gaps between women and men's experience through the recovery, kind of gender build back better, or build back better for women. So those were our priorities. What the government did was, in our view, get off to quite a good start. So we were having at the beginning 2 weekly, fortnightly meetings with cabinet secretaries, ministers with responsible for equality. They were listening a great deal to what women's organisations were telling them about the situation for women on the ground, and listening when we talked about some immediate concerns that we had. The permanent secretary, the chief civil servant for Scotland, wrote to all of the hubs of civil servants that were responding to COVID to emphasise that equality and human rights should be part of that work. And with my colleague Ailey Dixon, we managed to get into some of the coronavirus emergency legislation a clause that required Scottish Government to pay due regard to equality considerations when it was using the emergency legislation. So we tried to build in some building blocks. I think in terms of the overall response, and we're now obviously months later into the COVID response, we have seen some specific policies that have worked quite well. And so one thing government did do was invest a considerable amount of resource into women's safety, particularly in terms of men's victimisation. And so Rape Crisis and Women's Aid Services both got a considerable investment in order to provide their services in a way that would be safe throughout COVID, and bearing in mind the intensification of domestic abuse that services expected. We've also seen where government has engaged directly with women's equality experts, they have done some good policy making. And so there's a specific piece of guidance government's put out looking at home working and how that should be done, which is really, I think, quite good, and hopefully will create a little bit of space of progress that we can rely on even after COVID has passed and we're well into recovery, in terms of changing some of the norms around how civil servants work and how those in other sectors work, and creating more capacity for women to achieve a bit of work-life balance. However, I think there are also some more negative stories to be told. And we have seen, I'd say, almost the total collapse of gender mainstreaming inside Scottish Government. So there were just too many decisions being made without thinking about women, even when they were related to the most obvious circumstance for women. And so issues around care, around childcare, around how women would balance their working days, around the scheduling of school closures and reopenings, all of these things were kind of done without thinking about the impact on women's daily lives. And so we've seen a huge, staggering increase of the amount of unpaid care that women are doing each day, and a decrease in the paid work that women are doing by at least 2 hours a day, according to the best time use data that we currently have. Equality impact assessment and other mainstreaming tools didn't help. And so where we saw progress being made, where we saw good things happening, that was largely because of external experts to government advocating for those changes. So fellow women's organisations, sister women's organisations, and a small handful of real gender experts inside government, with the individuals making change. Otherwise, we think women and gender issues have been pretty marginal to some of the decision making. What I think has been particularly unhelpful and unfortunate is that we're now moving on to a slight space where rhetorically the impact on women and Black and minoritized people and disabled people of COVID is being acknowledged, but without the really substantive action that requires to be taken to address those harms. And so we see, and we saw this with a report on economic recovery, which the Scottish Government commissioned from a panel of economic experts, that there was, a good few pages of narrative describing the ways in which women had been structurally disadvantaged during COVID, and how Black and minoritized people did not have labour market equality prior to COVID, and were, radically overrepresented in the sectors which were likely to be most harmed by COVID. But nonetheless, none of the actions that were recommended by this expert group really addressed any of those circumstances, and certainly didn't engage with the structural questions. So we're a little bit worried about that some of this is as a bit of kind of performance gloss rather than deep engagement with the issues. So what Engender has been doing with this eventuality is a lot of engagement. There are a lot of processes happening in Scotland, partly because we're coming up to the election, but also because obviously there is this focus on how to, if not build back better, then make change happen in light of COVID. And I think in some quarters, truly COVID has surfaced some structural inequalities which are hard to ignore. And so we've been engaging with all of these processes to identify recommendations, proposals for change, trying to build up a head of steam around some of the ideas that we really want to see integrated into Scottish public life. And something we have been, along with sister organisations, slightly successful on is this question of care. And so we've gathered a lot of evidence about unpaid care, about the radical prioritisation or offloading of care from the state to individual women, and we've been talking about that a great deal. And off the back of that, there are some proposals to do some really exciting structural work to look at the value of care jobs in Scotland, but also to start thinking seriously about unpaid care as a policy issue, which is very exciting. So we've been doing engagement, we've been doing evidence gathering, we've been doing briefing, and we'll continue to fight really hard alongside other groups to get particularly the issue of care taken seriously as a policy issue. Like others across the rest of the UK, we've clapped for carers, but we haven't yet paid them. And one of Engender's long-term calls is for essentially a living wage for unpaid carers, and we'll continue to promote that as a policy call through the manifesto development processes and into the future. There's a question which I think we'll pay more attention to, but just to briefly mention it at the moment, women have been talking, of course, about long COVID and the potential for long-run impacts of COVID to have a profound effect on the way care is done. The additional demands on women who make up the majority of unpaid carers. And so this does seem to be an urgent issue for this discussion today, but also for all of our organisations to engage with over time. Thanks.
Thank you very much, Emma, for kicking us off with quite a wide range of things to keep our eye on, and I'm so pleased actually that you've set it out in this way, focusing both on where there have been examples of positive steps or maybe opportunities to build on, as well as rightly reflecting as well on places where processes that we thought might work have fallen down. So, you know, where in good times these mechanisms work for us, and in crisis points we see where they are weaker. With that, I'm going to move over now to Northern Ireland and introduce Jonna Monaghan, who is attending today for the, sorry, bear with me 1 second, for the Northern Ireland Women's European Platform, established in 1999 to give women and girls in Northern Ireland a voice at the national and international level. And the platform was recognising that women in Northern Ireland have a long history of peace building and playing a vital role in leading and sustaining communities in conflict, but that role hasn't been recognised adequately, not within the communities or internationally, and to give those women organisations an opportunity for their voices to be heard. Again, Jonna, there's 5 minutes at least, but if you want to take a little more time, you're very welcome to, and thank you again for attending.
Thank you very, very much for inviting me. So, and really, you know, I'm speaking for NIWIP, but really what I'm here to do is to try and, you know, share the work of the women's sector in Northern Ireland more widely, because thanks very much for that introduction. NIWIP's role sounds very complicated, but in a nutshell, the way I usually put it is that NIWIP acts as the link between the women's sector in Northern Ireland and the national level and international level. So we don't provide services, you know, we work with our members and partners and try and amplify those voices. And unfortunately, you know, this will probably not come as a surprise to anyone, but following Emma, you know, I have very little positive news to report. You know, in terms of the impacts of COVID on women have been, of course, largely the same everywhere. So we've seen a huge increase in unpaid care. You know, applications for universal credit from women doubled, and that was only, you know, by May time. There's been increase in violence against women. 5 women were murdered, things like that. But there's no real reflection, unfortunately, in the policy response at government level to the gendered impacts of COVID in any meaningful way at all. Women's voices haven't been represented. You know, we are part of a loose alliance of women's organizations known as the Women's Policy Group, who come together to share a policy resource. And through that group, the sector had to really fight to get a representative onto any kind of task force, and that's only for the engagement of the voluntary sector with government. Any, you know, government task forces, there's no representations of women as such. And, you know, we have seen very little evidence that there's specific consideration of the needs of women. So there was just, we we have had a partial lockdown since the middle of October, and we are going into an almost full lockdown from Friday for 2 weeks. And estimates of the impact of the lockdown that began in October, that they actually state, you know, this is the Department for the Economy states that women are going to be most affected, more job losses because it's female dominated sectors, and young women will be most affected of all. But there's no evidence of action at all. So for example, there's been some work on support for apprenticeships, but that has been largely focused on the sort of very male dominated sectors, IT, software development, construction. And you know, that's really what the sector as a whole, and NIWEP supporting that, has been focused on, just trying to keep highlighting the gendered impact. So in the early days, one early win was that it was highlighted that pregnant women were seriously disadvantaged by the furlough scheme. So if they were furloughed and they were on very low incomes, they would have fallen from maternity benefit to maternity allowance, and that was amended. But since then, so we have made calls around carers allowance, different things, and the focus really has been on what's become known as a feminist recovery plan. So, and I will put the link to that in the chat box when I finish talking. And that's really trying to collate all the evidence of what the impacts are and the women's sector's responses to that. And in actual fact, it is going beyond just COVID. So it's a very wide-ranging document looking at all the priorities for women, looking at actions in the short term, from short-term action on carers allowance to changing housing allocation policy. And one of the roles that NIWEP has played in that is to share evidence from elsewhere in the UK and Ireland and internationally. And we as well provide the Secretariat for in the Northern Ireland Assembly for an all-party group on, it's formally on UN Security Resolution 1325, but really we've used it just to feed in anything to do with the women's sector. And through that mechanism, we actually managed to secure a response from all the departments on what they're doing. But it just demonstrates the issues that we knew before, that there's no understanding gender and the mechanism aren't there. You know, we get responses, and this is not new. We get responses like things like, oh, we can't do gender budgeting because that would be disadvantaging men. And we're all about equality. So these are the that's the work we will be focusing on, you know, just keep highlighting these issues, and we will raise them as well in the CEDAW interim report. I've started work on it, and unfortunately it's quite a depressing no action. But you know, there has been very good collaboration within the women's sector, so we hope that, you know, by keeping pressure on, we can help build back better. Thank you.
Thank you very much, Fiona, for sharing that view from Northern Ireland. Starting first with your frank criticisms and concerns, but also interestingly, raising another tool or another element, that a way of engaging that is different to the Scottish approach. I'd be interested actually, when we stand back, to reflect across the devolved nations, what we think works, and whether that works across the context, or whether it's very much an individualistic, personalistic approach. I am now going to turn to Catherine, who's joined us from Wales, from the Women's Equality Network Wales. She's responsible for the overall strategic direction in pushing forward WEN's vision of a transformed Wales free from gender discrimination. She previously was campaign director at the Organic Trade Board, and also has worked as a campaigner at ActionAid and the Soil Association, and through her current role sits on a range of government boards around these issues. Thank you for joining us, Catherine, and again, I'll hand over to you for 5 minutes or longer as you choose to use it. Thank you.
Oh, thank you so much, Jennifer, and thank you to Engender for setting up this UKJCW call. I just wanted to really talk, well, first of all, I wanted to tell you a little bit about WEN, then I'm going to talk about what Welsh Government has done that's good, where we think their response has been lacking, and then I'll talk a bit about what we've been doing. So our vision at When Wales is a Wales free from gender discrimination, and to achieve that vision, we connect and campaign and champion for women and with women and with our member organisations. And really what we've all found, and I think what we've all been saying here, is that this COVID-19 crisis has taken a sledgehammer to any progress at all that has been made over the last few years on equality. I mean, one of the stats that I find most shocking and upsetting is that 59% of all deaths in the UK have been of disabled people. That was the statistics from the Office of National Statistics brought out very recently. So although disabled people only make up 16% of the population, 59% of the COVID deaths have been disabled people, and I think that's shocking and appalling. We've also all heard, and other speakers have referred to, the disproportionate impact that the crisis has had on BAME people too. So in terms of Welsh Government, what have Welsh Government done well? Well, I think it's very different in Wales. Before this, I worked in Westminster, and we didn't have such good relations really, I think, with government in Wales. And I don't know if that's true of all devolved governments, but it's very collaborative government. And so we find that Welsh Government really do listen to us. And we're involved in several groups, and we've got a fantastic Deputy Minister in Jane Hutt, who's long campaigned on violence against women issues and actually was involved in setting up our organisation 10 years ago. So there's good dialogue and we are listened to. And the good things that Welsh Government have done include, they were very quick to abolish the no recourse to public funds, which was really positive. We also campaigned for Vaughan Gething, our health minister, around getting telemedicine for abortion in place, so that women could have abortion at home, and that was accepted and very quickly changed. In terms of people of colour, and especially for us, we're interested obviously in women of colour on the front line, there was very quickly a risk assessment tool put in place to try and remove people from the front line where needed. And there has been extra funding for violence against women. But so those are the kind of good things. But the things that I think are still needing a lot of work are around childcare. So there were real difficulties, as Emma already alluded to, around childcare and around women, you know, having to take on more care burden, and I don't think it was properly thought through. And we really are calling, we've got an election as well in May 2021 for the Senedd, and so we're calling for good quality childcare, including for non-working parents, for all children from 6 months. Another big issue here around women's health, which is one of our key areas of work, is around women giving birth or going to antenatal appointments or having miscarriages and having to have those appointments alone. And that's a really significant impact on women's mental health and their partners as well. So that hasn't been so great, because we'd really like to see those rules relaxed about 2 people going to hospital. The third and kind of more overarching area where we feel more should have been done is around gender budgeting and making sure that all decisions that were made were done looking through a gender lens. And I know that's difficult, because I know this crisis has impacted everybody, and it's incredibly it's been, you know, governments have had to make really quick decisions, but we do think that a lot of the decisions around furlough, but that's a UK government issue obviously, but around supporting business and around childcare and schools should have been done with a gender lens by Welsh Government. So we'd like to see more progress there. So that's in terms of the Welsh Government's response, but in terms of what WEN has been doing, well, we connect, we campaign and we champion. So in terms of connecting, we felt it was really important that Welsh Government get the lived experience of women during this crisis. And so we started pretty much as soon as lockdown started, a monthly WEN cafe. And that cafe has different themes every month, and it brings together experts, not just from Wales, but from across the UK, to investigate an issue and to come up with really good policy responses that we then share with Welsh Government. So that's been incredibly important, not only for Welsh Government, but also for kind of fostering, bringing members and others together to talk about these issues and what's been going on, and providing that space to do it. And funnily enough, we found that our membership has really grown in terms of our reach, our geographical reach, because we are now online. And so that is one positive thing. So we've done our connecting with our WEN Cafe. In terms of campaigning, Hilary, our wonderful policy officer, has created our COVID-19 policy response, which has been signed up to lots of organisations and focuses on 5 different areas, or is it 4? No, making women safe at home. So that's in terms of violence against women funding, making women safe at work, prioritising women's health. I mean, one big thing we're worried about now that the kind of first wave is over is ensuring that women's health and operations that are needed, hysterectomies or things like endometriosis and all those illnesses that might be specific to women are really dealt with, and that women are not put to the back of the queue. And then the 4th area of our COVID-19 response is around tackling poverty. And a lot of that is in the UK Westminster Government's gift, but we want Welsh Government to really push for the increase in universal credit to remain, and to make sure that in Wales we have a really strong tackling poverty strategy. But we don't want to forget the other thing we really need to think about that's important is representation, because we think it's too easy to forget now as we're in a crisis and to kind of go, oh, well, equality and representation doesn't matter. Well, it does. It still really matters, because we're strong believers that if there were more diverse representation in our Senedd and in local government, then the decisions made would have been better in terms of the impact on inequality. So we mustn't let diversity in representation slip down the agenda. And in fact, we are running with partners Race Council Cymru East and Electoral Reform Services Cymru a campaign called Diverse 50/50, which is all about trying to get legislation in place to make sure that we have much greater diversity in politics, because I think that is really important. Thank you.
Thank you very much, Catherine. Again, it's fascinating to hear both the similarities and the differences in terms of the challenges that are faced across the devolved authorities, but also yeah, there are really marked differences in terms of the scope that our organisations have to work in, depending on our resources and the political and economic climate that we work. And I think that it's important to acknowledge that, and it's really good to come together in this way so that we can listen and learn. I also just wanted to assure everyone this was originally a 4 Nations exercise, and we have apologies from the National Association of Women Organisations. We have apologies from a lovely message from Margaret Clark, who is the UKJCW chair and also a trustee of that organisation. And she's just sent across a message saying that she's disappointed that we can't be joined today by NAWO, but that they do look forward to hearing back the work we've done today. And also, I think maybe if this is successful, probably there's scope for more another time. It feels like the challenges that we're facing here and the lessons learned will be front and center focused throughout 2021. I would imagine. It's not possible to separate these things from the main part of our work.